You're asking, is that time frame closing now?
Right.
I think it's hard to say because, it looks like our numbers have stayed in that. I have the report in that 757. The last time I look at this every week, this report. If you look since June, 740, 645, 707, 730, 744. So that's what I shared on that chart. So it's in the mid 700s to the mid 600s, back to 700, back to now the mid 700s. So that's for 5 weeks. So we haven't really seen. We were at 850 in mid-May. So we did have that was our highest point so far, again, of lab confirmed tests. So but we haven't had like an Omicron where there's that spike, or even Delta where it really spiked, like I guess a peak. We haven't had that definitive peak of cases, and then you would expect to see that peak of deaths or peak of hospitalizations, and then that peak of deaths. And sometimes it's just a cumulative effect of over time. I think that adds up because you just think about, think about those 5 weeks where we're averaging, let's say 700 people a week, 5 times 7, what is that, 3,500? So that's, those cumulative effects, it's like compound interest, it adds up. So then you have this large number of people that get COVID. Just as you notice the numbers game, you're going to have a number that are, even though it's a small proportion, there's going to be a number that get hospitalized and then the deaths.